Hi guys, welcome back to my channel Agape Vlogs. This is my 12th video. I'm so happy for all the subscribers who have walked into Agape Vlogs. Hope all of you are blessed through it, and I have a very happy and exciting news. That is nothing. I have a subscriber who has passed me a message that she has cleared CBT. I know many of you have passed it, but sometimes you won't have the time to come back to say a word of thanks or anything like that. Anyway, congratulations Lavina Saldanha, who has cleared CBT exams, and she has given me her message. And any one of you who have cleared the CBT exam and want to celebrate with Agape Vlogs, please do send me your names and photos if possible. Anyways, congrats to all those who have passed the CBT exams, and also best wishes for all those who are planning to appear for the exams. Few of you have sent me messages that you are taking the exams in the nearby days. Andrew Catalan from Philippines, Julie from Zambia, and Liji, I don't know her location, and few of you have mentioned that you're taking your exams, and I really wish great success to all who are my subscribers and who are going to be my subscribers. May the good Lord bless all of you. This is NMC CBT mock test 4 of part 1. I've already completed test 1, test 2 and test 3, and now we are going to test 4. Those who haven't yet gone through my previous videos, please do refer to those videos so it can help you in your preparations. Anyways, let's start the video. As usual, try to answer the questions yourself first and mark your scores. Question number 1. What serious condition is a possibility for patient's position in the Lloyd-Davies position during surgery? Options are option A, stroke, option B, cardiac arrest, option C, compartment syndrome, option D, there are no drawbacks to the Lloyd-Davies position. So the Lloyd-Davies position was developed to facilitate access to the pelvis for gynecological, urological and colorectal procedures. So there are cases where reports have demonstrated that prolonged adoption of this position has been associated with the development of bilateral compartment syndrome of the calves. So we have got the answer. Answer is compartment syndrome. Option C is the right answer. Coming to the second question, you have been asked to give Mrs Patel her midday oral metronidazole. You have never met her before. What do you need to check on the drug chart before you administer it? It's a very serious question. Okay, options are option 1, her name and address, the date of prescription and dose. B, her name, date of birth, the ward, consultant, the dose and route, and that it is due at 12. Option C, her name, date of birth, hospital number, if she has any known allergies, the prescription for metronidazole, dose, route, time, date, and that it is signed by the doctor and when it was last given. Option D, her name and address, date of birth, name of ward and consultant, if she has any known allergies specifically to penicillin, that prescription is for metronidazole, dose, route, time, date, and that it is signed by the doctor and when it was last given and who gave it, so you can check with them how she reacted. Options 3 and 4 sounds almost similar, but C is the right choice. Her name, date of birth, hospital number, if she has any known allergies, the prescription for metronidazole, dose, route, time, date, and that it is signed by the doctor and when it was last given is the right choice. So guys, in between, let me tell all of you, take care of your health. You know, globally we have been affected with an epidemic, so all of you take care. You who are involved in healthcare especially, please do take care of yourselves and others also. Everyone has to be very cautious these days. Okay, let's move on to the third question. Accurate post-operative observations are key to assessing a patient's deterioration or recovery. The modified early warning score, that is MEWS, is a scoring system that supports that aim. What is the primary purpose of MEWS? MEWS. We have already come across NEWS, NEWS. Now another word, MEWS, MEWS. So what is the primary purpose of MEWS? Options are: option A, identifies patients at risk for deterioration. Option B, identifies potential respiratory distress. Option C, improves communication between nursing staff and doctors. Option D, assesses the impact of pre-existing conditions on post-operative recovery. Option A is the right answer, that is, identifies patients at a risk of deterioration. So here you already had the answer in the question itself. Read the questions very carefully. MEWS is nothing but it is a tool that is designed to identify patients with declining conditions. It is used on all hospitalized patients to allow for the early detection of clinical deterioration and potential need for higher level of care. That is, the primary purpose is to prevent delay in intervention or transfer of critically ill patients. That's it. You already had it in the question itself, so I know all of you have got it right, otherwise too. Question number 4. Why is it important that patients are effectively fasted prior to surgery? Option A, to reduce the risk of vomiting. Option B, to reduce the risk of reflux and inhalation of gastric contents. Option C, to prevent vomiting and chest infections. Option D, to prevent the patient gagging. Option B is the right answer. It is to reduce the risk of reflux and inhalation of gastric contents. Question number 5. What are the principles of gaining informed consent prior to planned surgery? I think we have come across this as well. Options are: gaining permission for an imminent procedure by providing information in medical terms, ensuring a patient knows the potential risk and intended benefits. Option B, gaining permission from a patient who is competent to give it by providing information both verbally and with written material relating to the planned procedure for them to read on the day of planned surgery. Option C, gaining permission from a patient who is competent to give it by informing them about the procedure and highlighting risk of the procedure if the procedure is not carried out. Option D, gaining permission from a patient who is competent to give it by providing information in understandable terms prior to surgery. So don't give medical terms. You have to make sure that the patient has understood whatever is being told. Allowing time for answering questions and inviting voluntary participation. So this is the right choice. That is option D, that is gaining permission from a patient who is competent to give it and by providing information in understandable terms prior to surgery, allowing time for answering questions, that is patient should verbalize full understanding, and inviting voluntary participation. So that is it. So let's go on to question number 6. On checking the stock balance in the controlled drug record book as a newly qualified nurse, you and a colleague notice a discrepancy. What would you do? Options are: option A, check the cupboard, record book and order book. If the missing drugs aren't found, contact pharmacy to resolve the issue. You will also complete an incident form. Option B, document the discrepancy on an incident form and contact the senior pharmacist on duty. Option C, check the cupboard, record book and order book. If the missing drugs aren't found, the police need to be informed. Option D, check the cupboard, record book and order book and inform the registered nurse or person in charge of the clinical area. If the missing drugs are not found, then inform the most senior nurse on duty. You will also complete an incident form. So this is the right answer. That is what I've read right now, option D. And I am sure we have come across this question also, I think in test 1. And I know all of you have got this answer right. Question number 7. A patient in your care is on regular oral morphine sulfate. As a qualified nurse, what legal checks do you need to carry out every time you administer it? which are in addition to those you would check for every other drug you administer. Options are: option A, check to see if the patient has become tolerant to the medication so it is no longer effective as analgesia. Option B, check to see whether the patient has become addicted. Option C, check the stock of oral morphine sulfate in the CD cupboard with another registered nurse and record this in the controlled drug book. Together, check the correct prescription and the identity of the patient. Option D, check the stock of oral morphine sulfate in the CD cupboard with another registered nurse and record this in the controlled drug book. Then ask the patient to prove the identity to you. So option C is the right answer. Question was, as a qualified nurse, what legal checks would you need to carry out every time you administer it, and which are in addition to those you would check for every other drug you administer? It is: check the stock of oral morphine sulfate in the CD cupboard with another registered nurse and record this in the controlled drug book. Together, check the correct prescription and the identity of the patient. That is, option C is the right answer. Moving on to question number 8. As a newly qualified nurse, what would you do if a patient vomits when taking or immediately after taking tablets? So option A, comfort the patient. Check to see if they have vomited the tablets and ask the doctor to prescribe something different, as these obviously don't agree with the patient. Option B is check to see if the patient has vomited the tablets, and if so, document this on the prescription chart. If possible, the drugs may be given again after the administration of antiemetics or when the patient no longer feels nauseous. It may be necessary to discuss an alternative route of administration with the doctor. Option C is, in the future, administer antiemetics prior to administration of all tablets. Discuss with pharmacy the availability of medication in a liquid form, or hide the tablets in food to take the taste away. Option D is, discuss with pharmacy the availability of medication in a liquid form, or hide the tablets in food to take the taste away. Option B is the right choice, that is, check to see if the patient has vomited the tablets, and if so, document this on the prescription chart. If possible, the drugs may be given again after the administration of antiemetics or when the patient no longer feels nauseous. It may be necessary to discuss an alternative route of administration with the doctor. So guys, I'm also not well. I'm having severe cold. But still, many of you have told that you are taking the exam this month and I am quite disturbed and I am so very anxious, and I really want to help you out in the least possible ways I can. That's why I am back here. So please excuse me. I'm really sorry I am not in a position to give an elaborate video this time. So I'm putting just 10 questions. Question number 9. Why would the intravenous route be used for the administration of medications? Option A. It is a useful form of medication for patients who refuse to take tablets because they don't want to comply with treatment. Option B. It is cost effective because there is less waste as patients forget to take oral medication. Option C. The intravenous route reduces the risk of infection because the drugs are made in a sterile environment and kept in aseptic conditions. Option D. The intravenous route provides an immediate therapeutic effect and gives better control of the rate of administration, as a more precise dose can be calculated so treatment can be more reliable. The last one, what I have read right now, is the right choice. That is, intravenous route is used for administration of medications because it provides an immediate therapeutic effect and gives better control of the rate of administration, as a more precise dose can be calculated so treatment can be more reliable. Got it? So let's come on to the 10th question, and that's the last question in this video. What are the key reasons for administering medications to patients? Option A. To provide relief from specific symptoms, for example pain, and managing side effects as well as therapeutic purposes. Option B. As part of the process of diagnosing their illness, to prevent an illness, disease or side effect, to offer relief from symptoms, or to treat a disease. Option C. As part of the treatment of long-term diseases, for example heart failure, and the prevention of diseases such as asthma. Option D, to treat acute illness, for example antibiotic therapy for a chest infection and side effects such as nausea. Question was, what are the key reasons for administering medications to patients? It is as part of the process of diagnosing their illness, to prevent an illness, disease or side effect, to offer relief from symptoms, or to treat a disease. These are the key reasons for administering medications to patients. Okay, I know all of you know this. Anyway, good luck for our exams. I'll be back very soon. Take care of your health and wish everyone a grand success. Please do give me your valuable feedbacks, your results, etc. I am looking forward for all the likes, comments, etc. from your side as well. Take care. Bye bye.